Hello, and my name is Dr. Pam Garcy. I'm a psychologist and life coach in Dallas. I've been in practice for 17 years. And today we're going to talk about rational emotive behavioral therapy, REBT, and cognitive behavioral therapy, CBT. And I'm going to teach you a little bit about how you can apply some of these principles to your own life and to your own problems. So hopefully the things that we talk about today are things you can take home and use right away. These are things that I've been using with clients for many years, and I've found that they're really helpful with all age groups. Even, the youngest age group that I usually work with are older children, so maybe you might need a child that's a little bit older to benefit from it, but once they're pretty verbal, you can start using some of these concepts with them. So let me back up a bit and talk a little bit about REBT, Rational Emotive Behavioral Therapy. Albert Ellis was a psychologist who was originally trained as a psychoanalyst, and back in 1955 he established REBT. It was actually called RET at that time. He didn't have the behavioral part in there yet. And he was one of the first psychologists who was really making a break from that traditional psychoanalytic model, and was saying it's not necessarily the past conflicts that are causing people to have problems, but what's actually happening even more is the way that they think, the way that they talk to themselves, and what they allow themselves to believe that causes the problem. So he started, when he initially was in practice, he worked as an analyst, and he was quite good at it actually, but he realized that the progress was really slow, and that it was limited to very few people in terms of who he could help, because it's so expensive to go into analysis and it wasn't accessible to everybody. So also it's very hard to teach, and it required the analysts to go to lots of years of therapy of their own analysis before they could even provide it. So Ellis was quite aware of some of the drawbacks. In addition, because Ellis was sort of a sickly child, he did a lot of reading of philosophy and philosophers' ideas, and he was able to learn to apply certain aspects of philosophy to how he treated his patients. He started to realize that as he worked in a more active way with his patients, that he would see faster progress. And so all these things started to come together to help him to form RET in the 1950s. And he presented his first paper at American Psychological Association, I think it was 1955, establishing this model. And he said that he made this model called the ABC model of emotion. It sounds so easy and everything that you think, oh, well, it couldn't apply to me because it's too simple and I'm far more complicated, and there's just no way that we could break down emotional experience to something that's that basic. But if you look at the ABC model, which I'm going to explain in a minute, it might look basic on the surface, but there are so many other aspects to RET that it's actually really a very elegant model. It summarizes a lot of ideas in a really concise, easy to memorize way. And so then you can use it for yourself, and you can also use it to help others. So elements of this model were adopted later on by other therapies that started to emerge. Cognitive therapy was founded by REBT in the 1960s, and he used some elements of this model, even though he had some of his own ideas that he brought into play. And there are some definite similarities in those two models of treatment. Aaron Beck has done a lot of research on cognitive therapy, and the Beck Institute has really done a lot to advance it, and also for the use of REBT and REBT now called. So anyway, back to this ABC model. A can either stand for the activating event or the adversity. That's the thing that you consider to be the bad thing that's going on. And B is our beliefs about A, what we tell ourselves about this bad thing that's going on. C are the consequences. So the consequences can be very widespread. They can include emotional consequences, so how do you feel? Behavioral consequences, how do you behave, how do you act as a result of your belief? And also physiological consequences, which is how your body responds as a result of believing the belief. In addition, if you have this belief, and you can also have other consequences, but REBT therapists and CBT therapists don't usually look or talk so much about the other consequences. But in reality, we're also having consequences of holding the belief that I would say actually expand out into our families and can even expand out into our communities. So although those aren't the consequences that we're going to focus in on today, we're mostly focusing on the consequences to you as a person, you personally. We can remember that the consequences go out beyond the individual. Okay. So with this mode of therapy, what we do is we start to try to help you to realize that it's not the A, the adversity, that is causing your C, your consequence, but it's actually your B, what you believe, that's causing the consequence. So an example might be that if you, like, let's say it's the first time you came here, or a couple of you, first time you, well actually, all three of you. So it's the first time that you come here, and over there we have someone who's not just first timer, but anyway. But if it were the first time you came here and you were lost and you were running late, you might have thoughts about it, right? Did anybody have a hard time finding a place? You did? Okay. Did you have any thoughts about it when you came? Any thoughts about running late?
Probably just like maybe I won't go.
Okay.
Just go turn around because it's just.
Yeah, I can't find it, and I don't know where to go. Forget it. Just toss it. So if you believe that you shouldn't go because you're running late, you might have turned around and left, right? But then you did finally come, and you didn't have that belief, so you were able to walk into the room, right? So a belief can cause certain behaviors to happen. Did you have any feelings as a result of the thought, maybe I shouldn't even go?
Probably was just rushed, just that.
Frustrated.
Just, didn't really quite get to frustration. It was just kind of that rushed anxiety, I guess.
Yeah.
Kind of feeling like,
Yeah, that rushy, anxious kind of feeling, right? So that would be another C. So it's actually not the running late, though, that caused the feeling. It's the things that you were saying to yourself at that moment, right? And then eventually you did decide to come on in. So what changed there? What did you start thinking to yourself at that moment?
I think I was okay.
Yeah.
I think I was like, okay, I haven't started yet, so I was okay.
Yeah, all right, good. So you kind of looked in and you said, okay, well, they haven't started. It's probably all right to come on in.
Yeah.
Yeah. And then your feelings at that point?
I was fine.
Just calm. Yeah. So now, if you had said, when I had this happen at one of my last groups, somebody came in and we had started and we were rocking and rolling and stuff like that, and the person came into the group and she said, I'm used to. She said this to me after the group. She came in and she was clearly not happy that she had run late. And so I went and signed her in and I said, welcome, and I'm glad you made it, and don't worry about being here late. We just got started. You didn't miss anything. We're just doing the icebreaker, and please have a seat. And at the end of the group, she said, I'm so glad that you said that because I was thinking that everyone was going to ridicule me for coming in late, and so I was feeling really anxious. But when you were kind and everything like that, then I realized, I had some data that, she didn't say this part, I'm translating it into REBT language. She was kind of saying, I had some data that contradicted my idea that everyone was going to ridicule me, and then my belief changed. So she said, I realized that nobody was going to make fun of me and that it was a friendly group, and so I could go ahead and come on in. And so I felt calmer at that point, so thank you for, not ridiculing me. And I was like, phew, I was just about to ridicule you too. It's a good thing I didn't. But anyway, just kidding, I wouldn't have ridiculed her. But anyway, so that's what actually, it's an example of how our beliefs can cause our feelings. And if we get data that contradicts the belief, we can change the belief, and then we change our feelings. So if we get data that contradicts the belief, and we can change our belief, how do you think therapists help you to change your beliefs, or coaches? So if we get data that contradicts our belief and it can change our belief, how might we change someone's belief?
Continually challenging.
Yes, with what?
With gathering data.
Yes, exactly. Right, so exactly. So we're going to continually challenge ideas that aren't serving us by gathering data and seeing if it's true or false. And if we find out that it's false, then we can start to let go of the idea. So if we have an idea that we're believing, so, like Christopher Columbus, right? Like before he went out and all that, we just think the world was flat, right? But then we got some data. We realized we could let go of that belief, but we needed some data to let go of the belief. So that's one way we can start to let go of our beliefs. Another way, we don't necessarily have to go out and gather data, right? We can also look at data we already have. Sometimes we're just ignoring information. So we walk into a crowd and people are smiling and friendly and nice, and then we leave and we go, oh, I couldn't be friends with anyone there. No one's very friendly. And say you went with someone, and they would be like, but that one was smiling, that one said hello, this one said that, and then you might go, oh, yeah, maybe I just kind of went in not being open to what was actually happening.